Hey guys, so my name is Carla Gonzalez and I am doing my presentation over ongoing tracheostomy care to prevent patient complications. So the title of my article is Are We on the Right Trach? The National Confidential Inquiry into Patient Outcome and Death Examines Tracheostomy Care. So the problem. So tracheostomy formation is carried out in critical care situations to help patients wean from artificial ventilation and to improve their comfort. This procedure has become so advanced that many tracheostomies are being performed on high-risk patients at the bedside without the need to enter an operating room. However, new evidence suggests that early tracheostomy does not improve the patient's outcome. While the incidence of complications due to a tracheostomy are low, many patients present complications after the procedure. So, significance to nursing practice. There's a growing population where successful decannulization cannot be achieved and safe discharge proves difficult. Patients with a tracheostomy require a multidisciplinary approach, which includes attention to detail throughout the entire plan of care. Bedside staff must assess for potential complications that may arise due to the placement of a tracheostomy. Meticulous ongoing care of a tracheostomy is required to prevent these complications, and I'll go into that here in a sec after we go over the research findings. So I just want to read this part right here because I thought this was really interesting. So this study identified wards where patients with a newly formed tracheostomy were cared for and provided data on the approximate number of procedures being undertaken. 32 out of 219 hospitals, which is about 14%, were unable to provide data on the number of tracheostomy procedures undertaken. And in 101 sites, this figure was just an estimate. So that's already that they can't, provide data on the amount of these procedures being done is kind of concerning. So the most common indication for tracheostomy was weaning from artificial ventilation. However, since the majority of the procedures were done under an emergency situation, only 16% of formal documented safety checks were conducted in formed tracheostomy cases. Written consent was obtained in 48%. Consent is to be obtained when possible. However, many intensive care patients are unconscious at the time the decision for a tracheostomy is made. In the study, 95% of patients who were discharged from critical care with a cuff tube placed, of those same patients, cuff pressure was not measured in 25%. The equipment necessary to measure the cuff pressure was not accessible in nearly 1 in 5 cases. So the recommendation for nursing practice. So this study recognizes the importance of meticulous ongoing care to prevent complications. Staff at the bedside must have the knowledge, confidence, and competencies to act on potentially life-threatening emergencies. Competent staff must also be experienced enough to intervene when common complications arise. Nurses must assess the patient's ability to swallow due to research showing that insufficient attention is given to speech and language therapy involvement. Nurses must also be diligent about obtaining consent before these procedures are even performed. Special attention must be given to measure cuff pressure due to the fact that high cuff pressure can lead to complications such as sore throat, hoarseness, tracheal stenosis, necrosis, and rupture. Cuff pressure should be between 20 to 30 centimeters of H2O to provide an adequate seal. Cuff pressure should be monitored and adjusted if needed every 8 hours. And as always, good communication is necessary to achieve a satisfactory outcome for the patient. So I wanted to show you guys a picture of what a tracheostomy kind of looks like. And this right here is the cuff. And this is important because it prevents it prevents aspiration of saliva in patients who have trouble swallowing. So it's important that we measure that pressure to provide like an adequate seal, so aspiration doesn't happen. And I wanted to show you guys this video. It pretty much just shows us how to measure that pressure in the cuff.
To properly seal and measure cuff pressure, attach the manometer to the pilot balloon of the tracheostomy tube. Squeeze the inflator bulb to add air and pressure to the cuff while watching the needle on the manometer increase to between 20 and 30 cm H2O. The red air vent button located on the back of the manometer can be depressed to release air if the pressure is too high. Recommended cuff pressure is highlighted in green on the face of the gauge.
So overall, this study finds that shortcuts are being taken in emergency tracheostomy placements, such as not obtaining consent, failing to involve speech and language therapy, not assessing the patient's ability to swallow, and failing to measure cuff pressure every 8 hours. Now, all of these nursing interventions are important to carry out to prevent any more complications for that patient. So yeah, that is my presentation. Thank you guys.